Three-time Olympic medalist Lindsey Vonn is determined to ski in her fifth Olympics after tearing her ACL just last week. For certain athletes, it can be a sidelining injury, but others can work through it.
Her sport doesn't require a lot of twisting or pivoting on the knee. With her sport, her skis are most often parallel with each other, and she's moving her legs together through the hips primarily. And so because of that, there isn't that one particular time where she has to necessarily be concerned about that rotating on the fixed flexed knee. That's such a disadvantaged position for the ACL.
Dr. Jason Matuzak is the chief of sports medicine at Excelsior Orthopedics. He says just because you tear an ACL doesn't mean you can't participate in sports.
There's been instances where athletes who have torn an ACL can even do twisting and pivoting sports as long as they're protected and braced and in a spot where they're not putting that kind of stress on the joint too often.
He says Vonn's decision to compete is something she makes along with her doctors and coaches, but ultimately, as the patient, it's totally up to her.
We moved to this idea of, a shared decision-making process, which means that we're going to talk to you about what the actual risks are. Yes, you can compete, but here's what could happen. Now, as an adult, we have to trust that you're going to use our information to guide your decision in terms of what's an acceptable level of risk for you, given what the ultimate payoff is. Is it worth it to you?